Impacted teeth means that some teeth can be growing in such a direction that they're not going to come in. We often see this on wisdom teeth where there's not enough room in the back for the teeth to come in, and occasionally on some other teeth. In your child's particular case, we should be able to pick that up on the x-ray that I'm going to show you in a few minutes if that's going to be a risk. Temporomandibular joint problems are problems with the sliding hinge joint where your jaw connects to your skull. TMJ problems are rare in children. They can occur during the course of orthodontic treatment and can result in a popping or clicking, locking type of a problem with your child's jaw. We have these problems rarely occur in patients who don't even have braces on, so it's not clear really whether the braces is a factor in causing TMJ problems or not, but it's a risk that could occur during the course of treatment that I wanted you to be aware of. Growth pattern risks. That means that we can have a patient's teeth corrected with the braces, and then due to either a position of their tongue or growth of their face after the braces come off, a change can occur in the alignment of their teeth or of the bite that could change it for the worse. And although those things are rare, they can occur, and we wanted you to be aware of those too. Relapse is the next factor, and it's an important one because we know that teeth tend to move when we take the braces off. We try to minimize relapse by wearing retainers as soon as the braces are off, and also by watching the eruption of the wisdom teeth later on in the child's teen years so that we can remove the wisdom teeth if necessary to prevent the teeth from shifting a lot. Retainer wear, though, is the most important factor. We know that when we stop wearing the retainers after a period of time, the teeth are going to shift a little. That's just a given fact. People who do not want their teeth to move whatsoever after the braces come off will have to wear their retainers for an indefinite period of time, maybe only part-time, but still for a prolonged period of time to prevent any shift at all. Most people stop wearing their retainers after a few years and are able to live with a slight amount of shifting that the teeth are going to do once the retainers are discontinued. Periodontal problems are a result of the gums sometimes swelling a little bit during the orthodontic treatment. This is a factor that can be resolved quickly in most cases when the braces are removed. But in a few cases, we have to send a patient to a periodontist to get continued treatment on their gums, and sometimes it even involves minor surgery to remove excess tissue if it's become a real problem. That's most often a case in a child who has a lot of spacing between their teeth that has to be closed up during treatment. Unusual occurrences, sometimes, very rarely, these type of things occur, like you see on your sheet there, swallowing of an appliance that becomes loose during treatment, a tooth that might chip, dislodging of a filling, an ankylosed tooth, which means a tooth that will not move despite the orthodontic forces that are put on it, an abscess or a cyst that can occur in the jaws, and those things are exceedingly rare. And as I mentioned before, it's important that the child have their dental checkups on a regular basis while they're in braces so that their teeth can be cleaned and so that we can check for potential cavities that could occur during braces. That concludes the risks sheet. The next sheet that you have in front of you is our orthodontic policies in our office regarding our braces patients. I wanted to go over that with you too. First of all, we need to see your child about every 5 weeks for their adjustments while they're in braces. These appointments are important that we see the child on a regular basis for us to maintain good, steady progress of their treatment. It's good for you to go ahead and make the appointment for the following month while you're already here so that we don't lose track of your treatment. Second of all, most patients want to come in after school. We have a big rush for after-school appointments, and we understand that that's the best time for many people to come in. So what we do to share those afternoon appointments is we'll give you 2 afternoon appointments in a row and then ask you to come in the 3rd month earlier in the day so that we can distribute fairly those afternoon appointments. There are a few things we have to do in the morning because we just don't have enough time to do in the afternoon when we're going to be having a long appointment. For example, putting the child's braces on and taking them off are long visits. If we have a lot of repair work to do on the child's braces, or if we're doing the cleaning where we remove the wires, clean the child's teeth, and put things back together, we need a morning appointment when we have plenty of time to do those type things. Third, your child's progress. We'll keep you posted about how they're progressing every few months, but I won't necessarily come out to the waiting room and talk to you every month after an adjustment to tell you that we added a particular attachment or we changed a wire, because most of those things are pretty much the same each month. Anytime you have a question about your child's progress, feel free to ask one of the assistants or me about your child's treatment. Fourthly, broken appliances. We can charge you if your child breaks their braces. For the first 60 days, we'll repair their braces at no charge, no matter what they do to them. But during that first 60 days, they need to get used to the delicate appliances. They need to find out what they can eat and what they can't, and how they can avoid abuse of their appliances. So we'll repair those broken appliances for 60 days at no charge. But after that, they should know what they can do and how they have to take care of their appliances. And we can charge $10 for each broken appliance that we have to repair. Let me show you an example of one. This is a bracket that has come off the tooth. You can see it's still attached to the braces, but it moves on the wire. It's no longer glued to the tooth, so it's really not doing any good. When we have a broken brace like that, we have to take the wires out, clean the adhesive off the bracket and off the tooth, re-glue it, put the wires back in. And so you can see it's a time-consuming process, especially if we have 2 or 3 brackets each month to do. If that's the case, then we'll have to charge $10 for each of those brackets that we have to repair during the course of treatment after the first 60 days. In addition, if you've got more than one broken bracket or band to be repaired, call us in advance of the appointment and let us know that there's some breakage, because we're going to need to schedule extra time for that repair. Sometimes your child's treatment may not, your child's teeth may not respond to treatment quite as well as we want. We may have to change treatment during the middle of the braces or treatment. And in some cases, some additional devices may be required to get the treatment done. In those cases, we may have to make an additional charge if additional devices are required to get the result that we want. That doesn't happen often, but when it does, I'll let you know in advance that we're going to need to add some additional orthodontic devices. Number 6, if you move out of town during the course of the treatment, we will prorate the fee that we've charged you according to how much of the work we've done, so that it's fair for both you and for me. And we'll transfer the orthodontic records to the new dentist who will complete the treatment. Number 7, we've already mentioned your child's retainers. They're included in the price that you pay for the braces, and the follow-up care on those retainers is included for the first year after treatment in the original fee. If your child loses their retainer and we have to make a new one, then of course there will be an additional charge for that. And while I'm talking about additional charges, I wanted to mention what those are in review again. If your child breaks their retainer or loses their retainer and we have to make a new one, there's an additional charge for that. If they break their braces after the first 60 days, possible additional charge. If we need to add additional devices that we weren't expecting to have to do, we may charge extra for that. And of course, things like cleaning their teeth or extractions, fillings, or things that are not really related to the orthodontic care are charged in addition as well. That's all of the office policies I wanted to mention to you. The third sheet is our orthodontic discount sheet. This is something that explains an orthodontic discount that you can get by helping us with our schedule. You remember a few minutes ago I mentioned to you that so many patients want to come in after school to get their treatment completed. We have such a rush of patients at that time that it helps us to distribute our day on our schedule if we have some patients who are willing to come in the morning. We have a number of kids who are willing to come in, and their parents' schedules are such that it's not a problem for them to come in the morning for all of their braces adjustments. If that's the case, then you can bring your child in for all their braces adjustments at 1:30 p.m. or earlier in the day. Well, that helps our schedule out so much that we'll be glad to offer you a discount of 5% off the fee, and that amount comes off the down payment amount if you're able to do the morning discount for us. We'd like you to review these 3 sheets and sign them. We'll keep them in your child's chart in case you want to look at them again, and we have copies that we can give you to take home to look over these sheets at home at your convenience. Now that completes the video portion of the conference. In just a few minutes I'll come in and I'll show you the molds and x-rays of your child's teeth, and we'll go over some particular needs that your child has, some problems that may be present, and what we plan to do about each of those, and give you the opportunity to ask any questions that you have about your child's treatment. Appreciate it.